Heart failure is a progressive condition in which the heart becomes unable to pump blood effectively enough to meet the body's needs for oxygen and nutrients. Contrary to what the name suggests, heart failure does not mean that the heart has stopped working. Rather, it indicates that the heart's pumping efficiency has weakened, leading to inadequate circulation and, over time, serious health complications. According to the American Heart Association, more than 6 million adults in the United States live with heart failure. It is one of the leading causes of hospitalization among individuals over the age of 65 and contributes to a substantial burden of morbidity and mortality worldwide. Despite its prevalence, heart failure often develops silently. The earliest symptoms are subtle, and many people mistake them for fatigue, stress, or the normal effects of aging. Understanding these early warning signs is critical. Recognizing them can lead to early diagnosis, timely treatment, and improved quality of life. The following are 12 of the most important early indicators of heart failure that should never be ignored. Shortness of breath, or dyspnea, is among the earliest and most common symptoms of heart failure. It occurs because the weakened heart cannot pump blood efficiently, causing fluid to accumulate in the lungs. This buildup impairs oxygen exchange and makes breathing more difficult, especially during physical exertion. Initially, individuals may experience breathlessness while climbing stairs, walking briskly, or performing moderate activity. As the condition progresses, shortness of breath can occur even at rest. Many dismiss this symptom as lack of fitness or aging, but persistent dyspnea warrants medical attention and further cardiac evaluation. When heart function declines, fluid redistribution can occur while lying down, leading to a sensation of breathlessness known as orthopnea. People with this symptom often find it uncomfortable to sleep flat on their back and may require multiple pillows or prefer to sleep in an upright position to ease breathing. Orthopnea is a classic sign of left-sided heart failure, where the weakened left ventricle allows blood to back up into the pulmonary veins. The presence of this symptom should always prompt a detailed cardiovascular assessment. Peripheral edema, or swelling of the lower extremities, is another hallmark of heart failure. When the heart's pumping capacity declines, blood returning from the body slows, causing fluid to leak from blood vessels into surrounding tissues. This swelling is typically noticed around the ankles, feet, and lower legs. In advanced stages, the swelling may extend to the thighs, abdomen, or even the lower back. Pressing the swollen area may leave a temporary indentation known as pitting edema. While edema can have other causes such as kidney or liver disease, its presence, along with other cardiac symptoms, is an important warning sign of heart failure. A chronic cough, especially when accompanied by wheezing or the production of frothy, sometimes pink-tinged sputum, may indicate fluid buildup in the lungs due to heart failure. This symptom often worsens at night or when lying flat. The underlying mechanism involves pulmonary congestion resulting from elevated pressures in the pulmonary veins. Over time, this congestion irritates the airways and triggers coughing. Many individuals mistake this for bronchitis, asthma, or seasonal allergies, which delays diagnosis. A persistent cough in the absence of respiratory infection should therefore prompt further cardiac evaluation. When the heart cannot supply enough oxygenated blood to meet the body's needs, muscles and organs receive less energy. The result is a constant feeling of tiredness, weakness, or lack of stamina. Even after minimal exertion, tasks that were once routine, such as walking short distances or carrying groceries, may become exhausting. This type of fatigue is often gradual and progressive. Because it develops slowly, many people adjust their activity level unconsciously, believing they are simply getting older. However, persistent or unexplained fatigue, especially when accompanied by shortness of breath, can be an early warning of heart failure. Paroxysmal nocturnal dyspnea refers to sudden episodes of breathlessness that awaken individuals from sleep. It typically occurs several hours after lying down and may be accompanied by coughing, wheezing, or a sensation of suffocation. Sitting up or standing usually relieves the discomfort within minutes. This symptom reflects worsening pulmonary congestion that develops during the night as fluid redistributes within the body. Paroxysmal nocturnal dyspnea is a significant clinical feature of left-sided heart failure and should be evaluated promptly. When the right side of the heart weakens, blood returning from the body encounters resistance, leading to congestion in the veins. One of the most visible signs of this is distension of the jugular veins in the neck, known as jugular venous distension, JVD. This can be observed when a person is sitting or reclining at a 45-degree angle. JVD is an important clinical finding that reflects elevated central venous pressure and impaired right heart function. It often accompanies swelling in the legs and abdomen in right-sided heart failure. In individuals with heart failure, fluid accumulation in the small airways of the lungs can produce distinctive crackling or bubbling sounds, known as rales or crackles, when listened to with a stethoscope. These sounds typically occur at the base of the lungs and are more prominent when the patient takes a deep breath. The presence of crackles suggests pulmonary edema or fluid overload, both of which are serious indicators of cardiac dysfunction. This sign often appears before severe symptoms become apparent. As the heart struggles to maintain circulation, electrical disturbances may develop, resulting in palpitations, irregular rhythms, or an unusually fast heartbeat, tachycardia. These irregularities arise as the body attempts to compensate for the reduced pumping capacity by increasing heart rate. While occasional palpitations can be benign, persistent or irregular rhythms such as atrial fibrillation are closely associated with heart failure and can further worsen cardiac function. Continuous or unexplained heart rhythm changes should be assessed by a healthcare professional. Sudden weight gain over a few days, typically more than 2 or 3 pounds, around 1 kilogram, can indicate fluid retention due to worsening heart failure. Unlike fat accumulation, this increase results from excess fluid building up in tissues and cavities throughout the body. Monitoring daily weight is crucial for individuals at risk. A consistent upward trend should prompt immediate medical review, as it often signals the need for medication adjustment or evaluation for fluid overload. When the right side of the heart weakens, blood flow returning from the body becomes congested, increasing pressure in the veins that drain the liver. This may cause liver enlargement, abdominal pain, and a feeling of fullness or bloating even after small meals. As heart failure advances, fluid may accumulate within the abdominal cavity, a condition known as ascites. This leads to visible distension, tightness, and discomfort. Clothes may feel tighter, and movement can become restricted. Ascites signifies severe right-sided heart failure and often coexists with leg swelling and fatigue. Medical evaluation and active management are essential at this stage to prevent organ congestion and further decline. This condition, known as hepatic congestion, can also produce loss of appetite, nausea, or mild jaundice in advanced cases. Persistent abdominal discomfort with lower limb swelling strongly suggests right-sided heart failure.